Dealing with adult acne is just so frustrating. If you feel like you've tried every cream, every cleanser, and you're just tired of nothing working, you are definitely in the right place. In this explainer, we're going to cut through all that noise and look at the real, evidence-based clinical strategies that can help with hormonal acne and the scars it can leave behind. So let's get into it. It's a story I hear all the time. You get through high school, you think you're finally in the clear, and then suddenly you're battling breakouts in your 20s, your 30s, or even beyond. If that sounds like you, I promise you are not alone. But here's something really important to understand. What you're likely experiencing now is very, very different from the acne you might have had as a teenager. And this is where it gets really interesting when we break down those key differences. Okay, so teenage acne, that's usually all about those huge androgen hormone surges during puberty, and it pops up mostly on the T-zone, right? Forehead, nose, chin. But adult female acne, or AFA, is a whole different ballgame. It's this complex mix of hormonal cycles, stress, and lifestyle factors, and it loves to show up on the lower face, that classic jawline, chin, and neck distribution. And this distinction is so crucial because it means the treatment has to be different. We're not just fighting puberty anymore, we're dealing with a much more complicated picture. So let's really dig into what makes this condition so unique. Understanding that your adult acne isn't just some stubborn leftover from your teenage years is honestly the first, most important step to treating it the right way. It's a distinct clinical condition, and that means we need a totally different playbook to manage it. So, clinically, what are we talking about? Well, it's defined as acne that happens in women over the age of 25. And this can look like two things. It could be persistent acne that just never really went away, or it could be late onset acne that shows up for the very first time in your adult life. The key thing here is that it's driven by that much more complex mix of factors we just mentioned. And this slide really illustrates what makes it so challenging. The breakouts are often more inflammatory. Think red, sore, angry bumps instead of just simple blackheads. They tend to be deeper, forming these painful nodules or cysts under the skin. They're also incredibly persistent. I mean, a single spot can hang around for weeks, right? And because our skin just doesn't turn over as quickly when we're adults, the risk of it leaving behind a permanent scar is significantly higher. Okay, so this brings us to a really critical question. With thousands of products out there, it is so easy to get stuck in a cycle of just trying one thing after another, hoping something will stick. But there is a tipping point, a moment when you really need to step beyond home care and get some professional advice. So, how do you know when you've hit that wall? When is it time to step away from the skincare aisles and actually get a professional opinion on what's going on? Let's look at the signs. Here are 4 really clear signs. First, if you have been consistent, and I mean really consistent, with an over-the-counter routine for about 6 to 8 weeks, and you're seeing zero improvement, it's time. Second, if you're getting those deep, painful cysts we talked about, home care just isn't going to cut it. Third, and this one is huge, if you start to see any scarring or those stubborn dark marks left behind, you need to intervene quickly to prevent that from becoming permanent. And finally, if it's impacting your mental health and your self-confidence, that alone is more than enough reason to seek help. Okay, so you've decided to seek help. What happens next? Let's talk about our first clinical solution. When we're dealing with active, inflamed acne, one of the absolute best tools in a clinician's toolkit is the chemical peel. Now, I know the term controlled injury can sound a bit scary, but it's actually the whole secret to how this works. A chemical peel uses a specific acid solution to gently dissolve the glue that holds old dead skin cells together. This process does a few amazing things at once. It exfoliates the skin, it unclogs pores, it calms down that angry inflammation, and it can even help regulate oil production. So it's tackling several of the core causes of a breakout all at once. But not all peels are the same, and choosing the right acid is everything. The 2 most common ones for acne are salicylic and glycolic acid. Think of salicylic acid, a BHA, as a little heat-seeking missile for oil. Because it's oil-soluble, it can get deep down inside the pore to clean out all that gunk, which makes it incredible for those inflamed spots and for blackheads and whiteheads. Glycolic acid, and AHA, works more on the surface. It's fantastic for shedding those dead skin cells and really helps with the dark marks and texture issues that are left behind after a breakout clears up. But getting active breakouts under control is really only half the battle, isn't it? What about the marks and the texture changes that can linger for months or even years? This is where we shift gears from managing active acne to actually repairing the skin, specifically by tackling those atrophic acne scars. And it is an incredibly common issue. Studies show that almost half of all acne patients, up to 47%, will experience some kind of scarring. This happens when that intense inflammation actually destroys collagen deep in the skin, which is exactly why treating active acne early and effectively is so important. And these scars are what we call atrophic, which is just a technical way of saying there's been a loss of tissue, creating a little dip or pit in the skin. And they're not all the same. You've got ice pick scars, which are deep and narrow, boxcar scars, which are wider with really sharp edges, and then rolling scars, which create this kind of wave-like texture on the skin. So how can we fix this damage? Well, one of the most effective ways is with a treatment called microneedling. And just like a chemical peel, it works on that same principle of a controlled injury. We use tiny sterile needles to create these microchannels in the skin. This basically sends a signal to your body's own repair crew to get to work. It triggers this amazing cascade of growth factors and tells your skin cells to start building new healthy collagen and elastin. And that new collagen literally fills in and remodels the scar from the inside out. And the clinical evidence for this is really compelling. One major study found that patients saw a 51 to 60% improvement, on average, in how their atrophic scars looked after a course of microneedling. That is a huge, visible change, and it's all achieved just by waking up the skin's own powerful ability to heal itself. So we have peels for active acne, and we have microneedling for scars. It might sound simple, but here is the most important takeaway of all. Putting these tools to work effectively requires a truly personalized plan. There's absolutely no one-size-fits-all solution when it comes to this. And this quote from a research paper really just says it all. The process is complex because there are so many variables to consider. Your unique skin type, your specific type of acne, the different shapes and depths of your scars. An ice pick scar simply won't respond to the same treatment as a rolling scar, and what works wonders for your friend might not be the right approach for you at all. And this is exactly why getting a professional assessment is non-negotiable. A clinician can give you an accurate diagnosis. What kind of acne is it? What kind of scars do you have? Then they can create a custom plan, which might mean combining peels and microneedling, or something else entirely. Most importantly, they put safety first, making sure any procedure is right for you and your health history. And finally, they help you manage your expectations by creating a realistic timeline for achieving the best possible results. So if you are struggling with hormonal acne or the scars it's left behind, please remember that there are effective, evidence-based treatments that can truly help. The key is to move from guesswork to a targeted professional plan. Taking that step to get an expert assessment isn't about giving up, it's about taking control of your skin's health. So what will your next step be?